Minnesota Community Care is the largest federally qualified health center in Minnesota, and it serves a multitude of people across the state, mostly low-income immigrants, BIPOC people, patients experiencing homelessness. So we really are targeting underserved populations. The majority are also either on state insurance or uninsured. So we are creating access to care for people that generally face barriers. In addition, we have students that come through on their clinical rotations from the University of Minnesota. So that's my role. I work full-time at the Minnesota Community Care as a liaison. I'm hired by the University of Minnesota, but I work here with the staff and then oversee students treating these patients.
Wonderful. And I know you have the traditional brick and mortar clinic there. With teledentistry, and from what you had stated, you guys are getting out into the community using teledentistry, and that mobile care is kind of that satellite for the brick and mortar office. Is that correct?
Yeah, so it's been since about 2019 that Minnesota Community Care started using mobile clinics and teledentistry to increase access to care for patients experiencing homelessness. So there's a downtown St. Paul medical clinic that existed in the past. And what they were finding was that the need there was really great for dental care, because a lot of patients were coming in with emergency pain, oral infections. And so the medical clinic reached out to us asking if we would open a mobile site as a satellite clinic, as you mentioned, because we have a kind of a main site here that has 18 dental operatories. And then at that site, they just have a couple operatories. They send an advanced dental therapist there, as well as an oral surgeon. And so the advanced dental therapist is doing the new patient exams, doing all the data intake. And then a dentist at the brick and mortar site is using asynchronous teledentistry to review all of the x-rays, intraoral photos when they're taken, and perio charting, et cetera, creating a treatment plan, referring them to the oral surgeon as needed, or referring them back to our brick and mortar clinic for anything beyond the scope of the advanced dental therapist. Through the pandemic, they did start actually doing synchronous teledentistry as well. But they only were able to do telephone calls because we didn't have the capacity at that time to do video calls. So it worked. And in Minnesota, we were able to be reimbursed for exams that were done just via the telephone during the pandemic. But of course, that comes with challenges because we can't see exactly what's going on. We can't see if there's swelling. We just have to take the patient's word for it over the phone. I think not all dental providers are immediately on board because it is something new, and something like just a phone call feels a little less personal. So I think that is definitely a challenge that we faced, where people like the face-to-face interaction. So I think, programs like the one you have definitely open that and kind of reduce some of those challenges.
You mentioned synchronous and the video capabilities. Is that going to change the way that the possibility of the way your group is practicing?
So I think so. To be determined a little bit. I can definitely see scenarios where we have a lot of patients that commute to us even from 2 hours away because the patients that we serve, being that they're on state insurance, not a lot of clinics in Minnesota accept state insurance. It's we're unfortunately one of the most challenged states in the nation because of reimbursement rates. So we do see a lot of patients that come in. We're such a busy clinic, we only can dedicate 1 hour at a time to each patient. And as a federally qualified health center, that is a typical model. So patients have to come in multiple times, and sometimes it's just a visit where we chat. So I could see teledentistry definitely opening up convenience for those patients, reducing that barrier where they're trying to come in over and over and aren't able to get as much done as quickly as they would like to. The other thing is we want to kind of emulate the model the staff are already using with the students, given that we might bring in a dental therapy student, or even using a collaboration between the staff dental therapists and our students, trying to open that door of communication where we use synchronous or asynchronous teledentistry with them.
So what advice would you give to another program that is looking to create a teledentistry model or a mobile program?
Do it.
Do it.
Do it. I mean, I'm a big fan of teledentistry to begin with, but it's in order to see more patients, decrease barriers to care. I mean, I myself have been really enjoying telemedicine calls whenever possible. Just when you've got a busy schedule, it's hard to get in. So I think the patients that we have already been serving have really appreciated it. Especially that mobile clinic, by having this model where we don't have to have a dentist be there because we don't have enough dentists. It just opens up such a volume of patients that were able to be seen that weren't before. So I'm definitely, one of my mottos is, we need to be as concerned about patients that are not in our chair as we are about the patients in our chair. So if we can open our services up to more people, that's really the goal.